Okay, hello everyone. I'm Alan Rippin. I'm the Center for Active Living Director at Athens Community Council on Aging. So glad you're with us today for this talk on advanced care planning with Dr. Tiffany Washington. Before we get started, I did want to remind everyone that this is part of a larger series that's happening in Athens this month, sponsored by the National Endowment for the Arts Big Read program. And the selected book this year is Can't We Talk About Something More Pleasant by Roz Chast. She's the New Yorker cartoonist who's done this really wonderful graphic memoir, really sharing her experience as a daughter caring for her older parents through the end of their life. And so it's a really powerful book. And a lot of themes in the book are the inspiration for this event series and for our series at Athens Community Council on Aging, with talking about essential resources for adult children and older who are caring for loved ones. So to provide helpful resources and information to help us on the path. So I would like to go ahead and just say welcome, Dr. Tiffany Washington. So glad to have you. What a delight.
Thank you. Thank you so much for having me and for inviting me to be a part of this series. Thank you for those who are in attendance right now, but also for anyone who will be watching this from the YouTube channel. So I am really encouraged with regarding this topic today, advanced care planning, because my background is in healthcare social work, and as a social worker, I was involved in assisting individuals and families in advanced care planning process. But it's like since I've been practicing, even how I think about advanced care planning has really shifted, and I'll talk about that. So on today, we're going to discuss the process of advanced care planning, and we're also going to discuss tips for having conversations within your family system. So in this presentation, again, we'll start with defining advanced care planning, discussing the process. We're going to get into what are some of the barriers and benefits to advanced care planning. Then I'm going to show you various types, including some Georgia-specific forms. And then finally, we'll end with tips for having the conversation with your social networks. And so family, friends, however you define it, just think largely within your social networks and your care systems. So advanced care planning, I define it as an opportunity for individuals to discuss their quality of life, preferences, and values with their families and care teams. So if we break this down, if we just look at the care planning piece, that involves formulating care-related goals and delineating action steps toward those goals. So a care plan is developed and implemented in real time, right? It's something that you are actively doing, actively working on. But when we care plan in advance, so when care planning happens in advance, you have the opportunity to document your preferences and your values for care in the event you find yourself in a critical care situation. So you see here, I underline quality of life, I underline preferences and values for emphasis, because these are terms I want to make sure I come back to during our discussion. Advanced care planning became a requirement for agencies reimbursed by Medicare and Medicaid to inform individuals who receive care from places like hospitals, dialysis facilities, home health facilities, and so forth, about their rights to make decisions regarding care. So as a healthcare social worker, I was actually required to document that I at least asked, do you have an advance directive? Is this something that you would be interested in talking about? And that had to be documented per this act, the Patient Self-Determination Act. But unfortunately, completion rates for advance directives are low. Only about a third of adults in the US have completed at least one type of advance directive. And also, completion rates for Black and Latino people are lower in comparison to their white counterparts. And so as advanced care planning is useful, but it's an underutilized process, particularly among ethnic and racial minorities and also disadvantaged groups. So why are the completion rates so low? Well, there are lots of reasons. These are just a few. First of all, lack of awareness. People don't know what they are or how to access them or how to complete them. Another reason is the assumption that family members know the your wishes or the person's wishes. So if any of you remember the Terry Schiavo case, and she's not a case, she's a person, but her case in the 1990s and early 2000s, I don't know if that rings a bell, but this case brought the conversation about advanced care planning to the national stage. And if you remember, there was disagreement between her husband and her parents about what she stated her wishes were. So her husband insisted that she wouldn't want to remain in a persistent, unresponsive state, while her parents argued in favor of medical care to sustain her life. And so this disagreement among the family resulted in this long, years-long legal battle. So making the assumption that your family members know when you've never really had the conversation can um, create a lot of burden on the family system. Also, it's just difficult to have these conversations. Again, when I worked as a home health social worker, oftentimes during my assessment in the home, I would ask about advanced directives, and there would be like this notable relief that, I brought up the topic, right? Like, oh, finally we can talk about it. There's someone in here who kind of raised the topic. The conversations are just sometimes difficult to have. And that's because of this last bullet you see here, myths. There are pervasive myths and superstitions about advanced directives. That creates a barrier. So one myth I've heard, for example, is, oh my goodness, like if I sign these documents, that means something bad is going to happen, right? There are all types of myths out there. So if I'll ask you, and you can enter this in the chat box, what are some myths that you have heard pertaining to advanced directives that create barriers to completing advanced directives? If anyone wants to share a myth, you can speak it or you can type it in the chat box.
I've put everyone on mute, but you can unmute and ask the question, or you can type it in the chat box at the bottom. Anybody want to?
Okay. Well, we know that there are some myths out there, right? And so those myths, as I said, can certainly create barriers to completing the advanced directive. So then, the question becomes, well, why should I engage in advanced care planning? The answer is, what if? So what if something happens? We plan for a lot of what ifs in our lives, right? We just saw last week with the gasoline shortage that people were filling up plastic grocery bags, right, with gasoline. Like, we'll plan for a lot of what ifs. So advanced care planning really is an opportunity to plan for the what ifs related to our health and our health care. You also have the opportunity to alleviate the unnecessary. That's number two. So what do I mean by that? Well, the unnecessary burden of decision making that can be placed on your family. Also, the unnecessary treatments or suffering. I think the Terry Schiavo, her case really was, again, highlighted an example of that and brought the conversation of advanced care planning to the national stage. You have the opportunity to alleviate unnecessary costs and also unnecessary threats to your quality of life. And that term quality of life, I want to talk about for a minute. Earlier I underlined quality of life. Well, I think another barrier to participation in this process is that we, providers, social workers, physicians, nurses, all of us, we have not done a very good job of framing the conversation about advanced care planning around quality of life, which really, these are about making quality of life decisions. quality of life in general is a term that refers to a standard of well-being and satisfaction in all areas of life, our social life, our physical life, our emotional well-being, and so forth. And so another question I have for you, if you'd like to answer, what do you think of when you hear quality of life? What does quality of life mean to you? So the ability to make choices and have certain freedoms. Yes, exactly. The ability to make choices and have certain freedoms. That's a very good way of thinking about quality of life. And so we think, okay, right now in my life, if I am living, say, maybe free of a terminal illness or there's nothing serious happening, yes, quality of life for me is the ability to make choices. Well, also that should happen, that your definition of quality of life can apply across the life course, across the lifespan. It doesn't have to just be now when you're healthy or well or free of any serious conditions. So we usually frame the discussions when I talk about we haven't done a really good job of framing it around quality of life. We usually frame the discussion solely around end of life. Like we talk about end of life, but quality of life matters even at the end of the life, at the end of your life, as I said. So we reframe the conversation by asking, what does quality of life look like even at the end of my life? And so to show you an example of this, I love this. This is a values checklist by Somerset Hospital in Pennsylvania. If you look at it, it's essentially asking the question, what matters most related to your own health outcomes, goals, and care preferences? What matters most? So if you can see this here, the top is basic life values. Perhaps the most basic values in this context concern length of life versus quality of life. I have a quick story about that. I have a cousin, one of my cousins I grew up with, who lived HIV positive. And he, after so many years, decided that he no longer wanted to take the medications because the medications for him were causing him to be very, very sick. And he did not feel like his quality of life good. Although they were extending his life, his quality of life was good. And he taught me the most important lesson that I could have learned both as a person and as a social worker. My last conversation with him over the phone while he was in the hospital, he said to me, he said, Tiffany, I want you to understand that this is about my quality of life, not my quantity of life. And that was the most important lesson I could have learned because it really helped me think about, this is really about our values and how we think about, what values are important to us in life. And then you see down here, the second part, quality of life values. These are just a list of things that you may or may not be able to relate to. Things like, I want to feel safe and secure. I want to avoid unnecessary pain and suffering. I want to be treated with respect. And some others here. These are some ways to think about, well, what does quality of life look like for me, again, at all stages of life, including if I were at the end of my life? We're going to transition here because I want to now discuss what are some Georgia-specific documents related to advanced care planning, including documents that are not maybe more traditional advanced directives, but still promote advanced care planning. In 2007, the Georgia Advanced Directive for Healthcare replaced the previous law related to living will and durable power of attorney for healthcare. So it's now combined into one document that sort of captures the characteristics of both. And so we're going to talk about that too. And it still allows people to express their preferences and values for care. So the first program I want to talk about is the Georgia's Yellow Dot program. So Georgia participates in the Yellow Dot program. It's a free program that provides information, important health information to first responders who are trained to recognize the Yellow Dot sticker during a medical emergency. So there are various communities throughout Georgia that participate in the Yellow Dot program. Athens is one of those communities. In fact, you can obtain information about the Yellow Dot program from the ACCA, the Athens Community
I was
Council
going
on
to say
Aging.
we have the packets in the office.
Yes, you do. And the good news is if it does not exist in your community, you can actually obtain information about how to start the program if you in your community through the Georgia Department of Public Health. So you can go to the website and get information on how to start the program. But the packets come with a folder that you can leave either in your car or at home. And there's also a sticker that you can place in the lower rear window of your car or next to your main door at your home. And so in the folder, it's going to be important information like your general medical information, medical conditions, emergency contacts, allergies, medications, any important information that a first responder would need to know in the event there was some type of critical care situation or emergency. It also indicates if you have an advance directive, which you would include your copies in your yellow folder. So that would be there if, again, if a first responder were to have an interaction with you or a family member and you had some designation of this yellow dot program, they would automatically know, if they're trained in the program, would automatically know that there's some important information that they should refer to before providing care to you. There's a second type in terms of Georgia specific that is slowly being implemented. It's the POLST, Physician's Orders for Life-Sustaining Treatment. And this form provides your care teams information about your quality of life preferences related to life-sustaining treatments. So for example, do you wish for CPR to be attempted in the event of a serious illness? Or to what extent would you like to have comfort measures? Or what does quality of life look like for you? Is it intubation or medical ventilation or something like that? There's a professor at the University of Georgia in the College of Public Health, Dr. Toni Miles. She's done some work with the Georgia POLST, and I've heard her speak about it, and I actually documented this one quote from her once. She said, "The value of the POLST is that it facilitates a conversation that is hard to have. This form is designed to give patients an opportunity to sit down with their doctors and discuss their preferences regarding end-of-life care." So if a physician had an end-of-life conversation or discussion with someone and this form were in place, family members possibly would be less likely to respond with, say, surprise or anger or something like that, because these preferences and values had been expressed in advance. A living will is a little bit different from the previous form in the areas of things like age requirements and who can use it and how it's used. I describe a living will as a quality of life checklist, right? And so you get to make decisions about what quality of life looks like in the event that you are terminally ill or in a state of permanent unconsciousness. So this check reflects again, I'm going to say that as many times as possible, preferences and values around extending your life. Whereas the POLST is a portable physician's order that provides out-of-hospital medical personnel or legal authority not to provide, unwanted life-sustaining therapies, whereas the living will documents your care preferences. So there are some differences between the two, but again, still both relate to this process of advanced care planning. The other type I want to talk about is the healthcare agent. It's also known as, has so many terms, healthcare proxy, healthcare power of attorney, all of those terms, but it's the same thing. And this is a person who is designated to be your spokesperson when you cannot speak for yourself. Typically, you would designate a primary person and a secondary as well. This person should be, very important, should be someone who knows you, knows about your values and preferences, someone who you've had these conversations with and who you trust and you really feel like would fully represent your wishes if needed. In Georgia, a physician or a provider who's directly involved in your care can't serve as your healthcare agent, but this person does not have a duty to act, but their actions must be consistent with your intentions. And this person can consent to a specific treatment or withdraw consent from a specific treatment. So It does give this, I don't want to really use the word power, but I want to say representation of your beliefs, your values, and your wishes is what this says. So here are some frequently asked questions related to advanced care planning. Do I need a lawyer to complete an advance directive? The answer is no. Georgia's form, for example, in Georgia, the form is a legal form, but the directions must be followed, but the form itself is legal. Sometimes people ask, well, is there a fee to complete the form? Which again, I understand why the rates of completion are so low and why there are barriers, because again, this idea, and I've seen advertisements for pay this amount of money to complete your advance directive. No, there's no fee to complete the form. You can download the form in Georgia directly from the Georgia Department of Public Health website. Or a lot of providers and physicians' offices have the form available to you, sometimes community agencies. If you ask about it, you can probably obtain that form from some of your providers. Then there's this question of, can I change my mind? It's like, again, another barrier to completion. It's like, oh, but if I document this, it's like permanent and I can't change it. Yes, you can change your mind. You can cancel it at any time. You can amend it at any time. So it's living and breathing, but it doesn't mean that you can't make amendments to it as needed. Another question is, sorry, that's my dog. When should I create an advance directive? Guess what? Now, before you need one, or at the age of consent, all of the above, right? We, and when I say we, culture, society, have the tendency to wait until someone is of advanced age or someone is near some type of serious illness. And it should be done as soon as you are able to consent to doing it. So right now. Another question is the advance directive portable? The answer here is maybe. I'm so sorry, I have no idea what my dog is barking at. She's usually not that loud. Maybe. Most states make their own rules. So some states recognize out-of-state directives, but you would want to find out in advance if you're traveling, and you're traveling with your forms, if they're recognized out of state. So maybe. Is a living will and a healthcare power of attorney the same as my will and my power of attorney? The answer is no. Your will and power of attorney deal with assets and finances and may require an attorney's input, maybe, but the advance directives refer to health-related decisions, so separate. It can be part of larger planning. They are separate documents. And then finally, do I have to get my forms notarized? Not in most states. In Georgia, if you're using the official Georgia forms on the Georgia Department of Public Health website, you do not have to have them notarized. So not in most states. But again, if you are traveling or anticipating moving, that is something that you would want to look into in advance. And I am watching the time. I see it's 12:30. We will have some time for questions at the end. Just a few more slides here. Here is probably what we've all been waiting for, right? Because I understand the primary audience here is, adult children wanting to have conversations with their aging parents. But I want you to know, please know that I take an intergenerational approach to thinking about this, because I think to overcome myths and difficulties require, for normalizing advanced care planning within family systems, that it really does require a shift in sort of, I think, thinking and culture within the entire family system. So let's start with just values. Earlier we talked about values. What happens when family values and individual values conflict? Well, it makes having that conversation very difficult. So one thing you can do is to have a family's value conversation, maybe something over dinner. You're talking about, if someone brings up what's important to us as a family, what's important to us as individuals, how do those values overlap, and use that to segue into the discussion. And it doesn't have to happen in one night. It could be an ongoing conversation that you have that leads up to talking about using values as a way to thinking about quality of life and care at all stages of life. Another tip that I have is seize the opportunity. So you want to take it, you want to take advantage um, of family gatherings, things like reunions. I love reunions. We haven't been able to have many lately, but soon we'll have them again, hopefully. So reunions, holidays, but guess what? Even Zoom parties. COVID has changed how we stay connected to our loved ones. So even if there's a Zoom party, you can sort of bring this up, right? um, Seize those opportunities when everyone comes together, which if it doesn't happen often, you'd want to jump on that opportunity when it does. Another tip that I have is to use a neutral third party. And so remember, I told you that being a social worker in home health, usually when I brought up the conversation of advanced directives, and I'm asking the question because I'm required to, usually when I brought it up, I was able to serve as a mediator to get the conversation going, to start the conversation. And you know what? And again, there's like this relief, like, oh my goodness, finally someone else is bringing it up. And I could always tell that it was a topic that was approached before, but it just probably didn't go well. And so now that there's a social worker here, there's a neutral third party, yes, now maybe mom or dad will listen to this person if this, if it's harder for them to understand where I'm coming from. Another tip that I have is to host a family movie night. Now, the key here is to select a movie that gets the conversation going, like The Notebook, very popular movie if you've ever watched The Notebook. But The Notebook really hits on those themes, and we can have the conversation with our family, like, hey, by the way, have you ever thought about this? Another recent movie that I absolutely love is Jingle Jangle. It's a holiday movie, but if you've watched it, it's a Netflix movie. Jingle Jangle definitely has moments in it where you can kind of start that conversation with your family. So think about hosting a movie night, select a movie that's going to trigger that conversation and use it as a way to kind of ease into it. Another tip is to normalize the process by aligning it with celebrations. So an example, I have the most wonderful nieces in the world, and they are teenagers. They're 13, 14, my brother has 5. And they're all right in line. And so, in the same way that they are looking forward to, say, turning 18, like they're like, oh my gosh, I'll be able to vote and I can fill out my voter registration card. Well, why not also, those same milestones? Hey, and also, guess what else you get to do at this age? You get to start thinking about how you would like to be cared for if something were to happen. So if we start normalizing it within the entire family system, we have to take an intergenerational approach, right, to thinking about advanced care planning. Let me add in the chat box. Here's our final chat box question if you would like to respond. Do you have any tips that you would like to add? Is there anything that you have thought of? Is there anything that's working, or maybe something that you thought of during this presentation? Okay.
These were really good ideas. New one.
Well, and I'll probably think of others because, a lot of what's written about this is really healthcare providers having the conversation with patients. Like, how can we overcome barriers with that type of interaction? But we need to be talking more about how to have the conversation within the family system. For you watching today, how you as adult children can have the conversation with your parents. But again, and then thinking intergenerationally, not just my parents, but maybe children or nieces or young adults in your lives.
I think it's a good point, though, to say the catalyst could be the healthcare provider, because it is that third party. For example, I mean, I'm in my 40s, and my doctor last year handed me a blank advance directive form, said maybe you should look into filling this out, and I was sort of like, why? I'm young, and why would I think about that? And he was like, well, it's COVID year, and
Yes.
you're in your 40s, and it's always a good time. And so if he hadn't started that conversation for me, no one in my family would have, so
Right.
because we think, oh, you do have to be older or something needs to be going on for you to make this, to write this out. So that's a really good point about reducing barriers between a patient and a provider is a great first step, because they can
It
often
is.
be a catalyst for then that person going back to the family and saying, hey, my doctor got me thinking about this.
For sure, for sure. I completely agree. And you're right, though, when you say, wait a minute, I'm young, right? That's, again, that's one of those barriers. And it's like, I don't need this right now, because there's this assumption that we make that that's the type of thing that you worry about when you're of advanced age. And it's not something that I have to think about right
And I would say, for myself personally, it's like you don't want to think about it because you are afraid that you'll get locked into something.
now.
And then you also, I wonder if we sort of under or overestimate what we will want because we're not in that situation yet. And so there's a fear of like, we arrive at that moment and then we're like unable to speak what we want, but then we've changed our minds, so that can be a barrier too, I think is.
Yeah, which is why I made the point earlier that yes, you can change your mind. And you're going to see another point that I make. I'll just jump to right here at the bottom. Excuse me. That things change, right? So we evolve. So as individuals, we evolve in our values and our thinking. As family systems, we evolve. The dynamics change. The family composition changes. And so when those changes happen, yes, you have the opportunity to think differently or rethink the decisions that you made at the time. Um, I also want to say, so my best friend is a social worker, and she knew I was preparing for today. We talk about all things social work all the time. And she is also a healthcare social worker, and she has conversations with families and individuals about advanced care planning every day in her work. And she asked me to share something with you. Here's what she wanted you to know as a concluding thought. She said, she wanted you to know that the process of advanced care planning is your right to exercise independence and autonomy over your plan of care. So I'll say that again. Your right to exercise independence and autonomy over your plan of care. I think that's very empowering to hear. That it's your care, your right to insert your independence there. Also, I'll say some other tips or concluding thoughts that you see here. Keep the conversation going, especially if you find it difficult at first. It doesn't have to end at the signing of documents. That's what we want to happen, but that doesn't mean that that's where the conversation stops. You can continue to have the conversations within your families. Also, again, was just this idea that remembering that we as individuals evolve. All right, and so that concludes my presentation. I was asked to leave about 20 minutes for questions, and so I am right on target. Thank you so much. What questions do you have for me?
Yeah, any of our participants want to ask anything?
You talked about the difference of will and power of attorney as compared to the other method. If you have a power of attorney for healthcare, is that sufficient?
Sufficient for healthcare decision making?
Yes.
Yes, one document can live on its own. Now, as a social worker, I oftentimes advise people to consider multiple advance directives, maybe not just the healthcare agent, but also the living will. But it's not to say that it's because one can't live it on its own, because it can. But again, I think it was just, the more places or the more ways I am able to express my values and preferences is really ensuring that they are honored when it's necessary, that my wishes are respected when it's necessary. But yes, your question, is it sufficient? Yes, it certainly can live on its own. One document is okay.
If you have multiple documents, I guess you would have to be careful to make sure that they all synchronize with each other, because you could have one saying something that the other doesn't address.
That is an excellent point. Yes, you're exactly right. So that's why we really want to make sure we have these conversations so that if there are discrepancies, we can identify them. That is an excellent point that you're making. I completely agree. You want them to be paired together and travel together. So, if you're giving a healthcare power of attorney form to a physician, make sure you're also giving your living will, but make sure that they, are sort of a package deal, right? That they travel together wherever you're going to be giving them to. And in terms of where they go, yes, you can give them to physicians and providers, family members, leave them at home, like with the Georgia Yellow Dot program I mentioned earlier. You can designate, hey, I have forms in my home, take a look, but you can distribute them to all of those places.
Is there a website that one can get the POLST forms from, the Georgia?
Yes, there is, and we can drop this in the chat. So I'll just stop share and I can go ahead and go. I dropped this in the chat. I've been on the website several times preparing for this.
Okay.
All right, here. So this is the form, as I said, in 2007, this changed for Georgia. There you go. Other questions?
I have been a member of the Yellow Dot program for a long time, and we have it posted on our refrigerator. We have stickers on our cars. They're getting old now because we've been in that program for a while. I really didn't even know that it was still effective. So I'm glad to know that it's still available.
Yeah, and where at the Council on Aging can someone pick that up?
At the office, the Cal Center
Okay.
office, we have them. But I think we weren't sure too if that was still I know it was a pilot program for a while and then it kept going, but I think we were wondering too if it's really active and current and we should still be promoting it, so.
Well, yeah, as far as I know it is, but yeah, let's definitely check to make sure that it's still in existence.
Yeah, but we do have, if someone comes to the office or gives us a call, we can connect them to that for sure.
Okay, so pardon my ignorance. That website came up very briefly and is gone. So can I, will I be able to access it?
Oh, no.
Or,
So did you,
And I can also email this to everyone.
yeah, that would be good. That would be good.
Yeah, but then anyone watching later, oh, I see. It's not underlined anymore. So it's a PDF file. Was that what you first?
the first one is the PDF, but then the second one is the link to the direct page on the Georgia Public Health website.
Okay, so
Click that one. It will take you to the website.
okay,
Yes.
all right.
Yeah, we'll try
Great.
that.
Yes, but the first one is the actual PDF of the forms. Yeah.
I have a question just going back to the will aspect. So if someone's wishes are in their will, do they need to have it as another document, as a advance directive kind of standalone document, or if it is part of the will, what is that enough?
The reason I think even if it's documented in the will, to have specifically the living will or healthcare power of attorney separate from that is, the right people may not see those wishes until something happens, right? Because usually with the will, it's kind of cracked open after the fact. So, but with the latter, you can distribute those now, right? And make your wishes known now. So I think that even if you've said that in the will, to have them in a document that can be distributed to people when you are able to, speak for it and defend it or whatever the case may be.
And who should have a copy of that? Obviously a family member, but then do you have your doctor has that, or who has?
Yes, family members, physicians. And you reminded me of one thing. If you update it, amend it, make changes to it, make sure that it goes out to all of the people who you gave the previous forms to, so that you're saying, hey, give me that back. I've updated it. Let me give you this. Also, as things change within the family system, so like a marriage or, you know, maybe a divorce or whatever the changes may be, you may want to think about how that might affect maybe someone who you designated or whatever. You want to make those changes then as well.
Okay, that's helpful. And then it's more of a comment, just sharing a story. So I had a close family member pass away, and we had to make a very difficult decision about, you know, what we would do at the end of their life, his life. And we did not have necessarily an advance directive sort of, you know, piece of paper, but I think maybe this would be helpful for people is we knew him well enough to know what kind of quality of life he would want. I mean, obviously it's better if he could say, this is it, but we had to make a consensus agreement amongst family members. And so that's what we had to draw from, is the spirit and essence and, you know, personal,
Right.
I'm trying to think of the word, but you know what I mean? Sort of like, what would this
I do.
want to live? How would they want to live? What would they want to be able to do? Is it read a book? Is it, you know, go fishing? Is it, you know, and that was really what we had to work with. What are your thoughts on that? I mean, obviously the best case scenario is to have it from that person in their words, you know, on a piece of paper, but if that's missing, you know, what do you do?
I mean, you know, first of all, let me just say that, you know, when a family is or you said someone close to you, someone you love, you know, you have that kind of bond and connection to where you feel very confident that you can carry out what you believe that person's wishes to be. I think that's fantastic, right? And I think that itself is still part of this advanced care planning process, and that tells me that maybe you've had this conversation, maybe not directly, maybe in some indirect way, that you feel very confident that that can happen. Yes, the best case scenario is to have have it documented. You know, there have been just too many and again, as a social worker, I've seen it to where even as confident as you said that there's been disagreement, right? Even as confidently as you spoke, that there's disagreement, and I've seen it happen. But in all fairness, I've seen disagreements when the forms are available and there has been documentation. Because that's just the nature of family systems and family dynamics, right? And maybe we don't agree with a person's individual decision. So even then, it's not saying that it would be totally free of the burden, but it does help.
And in those situations where those dynamics can get tricky, what do you recommend to facilitate that conversation? Yeah.
Well, so I that comes up a lot, and the first thing I always say is when it, you know, people start to ask legal questions at this point, right? You have to understand the laws in your state. Definitely defer to, in this case, Georgia laws, but know the laws in your state regarding what happens when there's contention, what happens when there's disagreement. I have known physicians to defer to families' decisions. I have known the forms to really stand strongly. Again, you have to know what the laws are in your state. And in terms of what I recommend at that point, so for one thing, there are healthcare systems that have like ethics boards and commissions, people who can gather together to help facilitate those conversations. Sometimes it may require you to defer to a neutral third party at that point. Social workers, bring in a mediator that can help. Because at that point, and because simultaneously there's grief and loss, right? And you're experiencing that. And so it could be even more difficult to have the conversation. So I would say at that point would be when I would bring another person in to help, facilitate the discussion.
Good point. Absolutely.
I have another question. You said know the laws of your state. Now, is there a time limit with the date on these documents, especially for the advance directives? For the state of Georgia, is there a limit? Because I cared for my parents and I we were well prepared, but one person in the emergency team remarked that the forms were more than a year old. So is this an issue in Georgia?
That's a great question. That's a great question. In Georgia, and as I understand the law, in Georgia, that 2007 date matters in terms of when they revised the law. So if there were forms existing prior to that, they can still stand until they become sort of changed, or, so, being able to acknowledge those forms that have been created before 2007, but any after 2007, anything documented at that time does stand. So I am not familiar with anything that dictates that, after a year you should be revisiting it, but it is good practice. It is okay to say, you know what, hey, let's talk about this. Let's make a point to talk about this maybe annually, or every 2 to 3 years. I think that is good practice because, again, as I said, we evolve as individuals. Families evolve, things change, there are major life events, and so it could be good to revisit. But legally, I am not aware of anything. I'm very careful to say anything incorrect when it comes to the law. But as I understand the law, that 2007 date for Georgia, that really matters. And you can find all of this information on the website.
Yeah, thank you.
Thank you. Thanks for all of your questions. They've been really, really great.
Anything else from anyone else? We've got just a couple of minutes left. Yeah. I think we've covered a lot of ground. Thank you so much, Dr. Washington. I mean, lots to think about, and you've given such good practical advice, but also a conceptual reframing of how we go about this. And I love how you think of it as a quality of life, and not making it a fear-based conversation in a way,
right,
but more a life-affirming approach, which I think I really value that, and hope we can continue to have conversations based on that. This helps us kind of rethink something. So
that's great. And if you were able to pick up on my reframing, that's all I can ask for, because that's really what I hope we do as a society, is to really shift how we talk about advanced directives. And as you said, life affirming. And that's absolutely what it is. And again, I didn't start off this way as a social worker because I wasn't trained in the healthcare system to think about the medical model. We were trained to think about it in terms of end of life. And it took some time for me as a social worker to think about my identity in this profession, and why, I don't have to do it this way. I should do it in the way that my profession's values dictate. And so that's what I was able to do.
Oh, yeah.
Thank you so much for having me. This has been wonderful. I'd love to come back and talk more at any time.
Anytime. Open invitation anytime. Yeah, and thank you to you guys joining and anyone watching. We'll stay in touch, and thank you so much.
Thank you.
Yeah.
Thank you.
Thank you.
Everyone.